Now, as a nurse, when I'm looking after a patient, one of the things I need to know is that patient's past medical history. I need to know if they've got any medical conditions that they are being treated for. Now, one of the common medical conditions that I've come across is hypertension, high blood pressure. Now, anyone can get hypertension regardless of race. Anyone can get it. But historically, high blood pressure or hypertension has been shown to affect Africans, Afro-Caribbeans, African Americans, or Black people disproportionately to their white counterparts. Now, if we're to be honest, the majority of us do not intentionally go out of our way to have our blood pressure checked. We don't just wake up to say, okay, today I want to have my blood pressure checked, or I want to know what my blood pressure is. That doesn't happen. At least for the majority of us, we don't do that. It is only when we start to feel something that we start to think, okay, maybe I need to check my blood pressure. Maybe I need to go to see my GP and find out what is going on. And if you have hypertension or high blood pressure, by the time that happens, it means, unfortunately, it means that your blood pressure is now at an advanced stage. This is why hypertension or high blood pressure is called a silent killer. It is silent because you won't know for ages until something happens, until you start to feel something, until you start to recognize that something is happening, something is wrong. But unfortunately, what that means is by the time that happens, by the time you start developing those symptoms of high blood pressure, it means that you've been dealing with it for a while without realizing it. So this is why it is crucial that we are aware of this medical condition, because according to statistics or according to the medical evidence that is out there, hypertension or high blood pressure is a significant health concern among Black communities worldwide. And again, according to the numbers, according to statistics, we are seeing an increasing number of deaths connected to hypertension or high blood pressure. Now, quite quickly, I want us to look at blood pressure. What is blood pressure? What is normal? What is abnormal? What are the symptoms and so forth? But most importantly, I want us to look at why Africans, Afro-Caribbeans, African Americans are mostly affected by this illness. Now, let's look at blood pressure. Now, if you come to the hospital and I'm checking your blood pressure, after I've put the cuff around you and I press the machine, it will come up with two numbers, and that's how blood pressure is recorded. Now, the number at the top is called systolic pressure, and the one at the bottom is called the diastolic pressure. Now, both these numbers are measured in millimeters of mercury. Now, I won't go deep into what is happening in the heart when we're measuring your blood pressure, but what's important to know is those two numbers. So when we measure the highest number, it means your heart is contracting. And when we're measuring the lowest number, it means the heart is now relaxing and blood is flowing through the blood vessels. Now, let us look at what is considered to be normal. Now, according to the British Heart Foundation, normal blood pressure, or what is considered to be normal or ideal, is between 90/60 millimeters of mercury and 120/80 millimeters of mercury. Now, for older people, this number gets a bit higher because as we age, our arteries become stiffer. There are fatty deposits now around our arteries and so forth. A lot has happened over the years, and this is expected as we get older. And there are times when you measure your blood pressure, if you're someone who's keeping an eye on their blood pressure, there are times when you measure your blood pressure and you start to notice that the numbers are starting to creep up. It means that you are now at risk of developing high blood pressure or hypertension unless you do something about it. Although having said that, it is important to mention that what is considered normal for one person may be abnormal for another person, because we all run on different blood pressures that are considered normal. Some people run on low blood pressure that is considered normal for them. Some people run on slightly higher blood pressure that might be considered ideal for them. So it all depends on the situation, on the circumstances, on what is going on with that person. So what is hypertension? When is someone considered to have high blood pressure or hypertension? So high blood pressure is normally from 140/90 millimeters of mercury or more if your reading was taken at a pharmacy, GP surgery, or in the hospital. It is because some patients, when they are not in their normal environment, if they go to the hospital, to the clinic, to the pharmacy, they develop what is called the white coat syndrome, which raises their blood pressure. This is why the thresholds are different than when someone's blood pressure is taken at home. And we also have what we call essential hypertension. This is the most common form of hypertension. It means that it's not so serious and it is usually reversible. It means that it hasn't really damaged a lot of things in your body. Now, if you've got hypertension or high blood pressure, you are at a greater risk of developing cardiovascular disease. Now, I've listed diseases here. You're at a risk of developing heart disease, heart attacks, stroke, heart failure, artery disease, aortic aneurysms, kidney disease, vascular dementia. So you are at a risk of developing these diseases, and these are life-threatening conditions. They are the major killers. If you look at the statistics, the top diseases that kill people yearly, you will find that these are the highest killers, and these ones are linked to hypertension. They have a link. This is why this medical condition should be taken seriously. Now, let us look at the risk factors. What makes you prone to developing hypertension or high blood pressure? Now, family history of hypertension. If someone in your family, if there are people in your family that have got this disease, chances are that it runs in the family. And also, if your age over 65, as I said before, the older we get, the more at risk we are, because our arteries stiffen up as we get older. And also, if you've got coexisting medical conditions such as diabetes, kidney disease, all these medical conditions are linked, because if you've got high blood pressure, you are at risk of developing kidney disease. If you've got high blood pressure, you're also at risk of developing diabetes as well, because it has been shown that people with high blood pressure have got high resistance to insulin. Another risk factor, and now we're coming to our problem. Another risk is if you're African, if you're Afro-Caribbean, if you're African-American, if you're Black. Now, the causes for this vary according to what's out there, the research evidence that is out there. Now, some of the causes why Black people are mostly affected by high blood pressure, and if we know what causes high blood pressure, then we will better understand why Black people are mostly affected. Now, some of the causes, according to what's out there, some of the causes are genetic, and some of the causes are social determinants. Now, we're looking at things like poverty. If someone lives in a deprived area, if someone comes from a low socioeconomic background, and by the way, this doesn't necessarily have to do with having money. There are other factors that come into play. Now, generally speaking, according to the numbers, the statistics that are out there, these are things that are well documented, well talked about, well known. If we're looking at the numbers, you will find that, or the numbers show that Africans, African Americans, or Afro-Caribbeans, or Black people in general, because I'm constantly being corrected in the comment section saying, oh, don't call yourself Black. I mean, I am Black. There's nothing wrong with being Black. I am Black. I'm African, of course. Now, according to the numbers, according to the statistics in the UK, in the US, or other places, Black people are disproportionately poorer compared to their white counterparts or compared to other races. So because of poverty, because we know that poverty affects a person's health, it affects access to healthcare. It affects a lot of things, or in a number of ways, because if someone is poor or is struggling in life, then their life is more spent in that frame of mind, struggling in that struggle mode. They are less likely to think about exercising. They are more likely to live in a stressful situation because of poverty. Because if you lack certain things, certain basic things in life, you're more likely to be stressed out most of the time compared to other people. And we know that stress is also one of the causes of high blood pressure. It causes hypertension if you're constantly stressed out. And as immigrants living in the UK or other parts of the world, because of our situation, our circumstances, especially what we have seen in the last few months here in the UK, the visa rules, the constant changes in the visa rules, constantly worrying about the immigration status, what is going on, the uncertainty. And I did a video, a whole video about stress. I'll put the link at the end of this video. And I talked about what stress does to us as people, as immigrants. And because stress is one of the risk factors of high blood pressure, it means that we are more prone to developing that medical condition. Another reason as well is that Africans or Afro-Caribbeans or African Americans or Black people are sensitive to salt. And because of that salt sensitivity, it means that our blood pressure is going to be about 10% higher than the general population if we consume food that is high in salt, which brings me to the other risks. The risks that we have control over, we call these modifiable risks. Risks such as our weight. If we're overweight or if we're obese, we can always do something about that. We can always improve our diet. We can always incorporate exercise as part of our routine. We can always stop smoking. We can always control our alcohol intake. And when it comes to things like stress and our living situation, I've put question marks on that, because there are times when we can't control the stress that comes our way, especially if it's regarding our visa situation. And by the way, we all experience stress. A bit of stress is good for us because it's a motivating factor. It motivates us to do something about our situation. But if that stress is not controlled, that's when we start developing these diseases such as hypertension or high blood pressure. So that's why I said we can control it. And I made a whole video about stress. I'm going to put a link at the end of this video so you can watch that video. I go into detail as to what is stress, how we can control stress, how it manifests, and so forth. So these are the risks when it comes to Black people, Africans, Afro-Caribbeans, African Americans. There are social determinants and also there are genetic factors as well that come into play. So then how do you know that something is going on, that something is wrong? Now, I've put a list of the signs and symptoms. Some of these symptoms include severe headaches, chest pain, dizziness, difficult breathing, nausea, vomiting. I mean, you can't take one symptom and run with it, concluding that, oh, I've got hypertension, I've got high blood pressure. No, which is why it is important that when you experience these symptoms, you go to your GP and take things from there. It is always wise. That's the best thing to do. If you start experiencing these symptoms, then call up your GP and take things from there. And also, again, when it comes to treatment, now I have been reading that when it comes to treatment and high blood pressure, Black people tend to respond to certain medications better than other medications. Again, I emphasize, go and see your doctor and take things from there. They are the experts. They know which medications to give you depending on your symptoms, depending on your situation. Now, the most important take from this video is that hypertension or high blood pressure is a lifestyle disease. It is something that you can do something about if you do it before it is too late.